information as we can, provide you as much information as we can about our funding opportunity for this next cycle. And that includes also some changes to the strategic plan, our strategic priorities, some small changes to our application process, and other changes too to our funding approach as well. We also want to start off too with giving you a big picture about Verdant. Most of you are probably familiar with Verdant Health Commission, but we want to give you a chance for those of you that may be new to your organization to also have that opportunity. And I am joined with other colleagues today. We have Maggie Konstanski, which most of you may know from other from your work if you're a funded partner currently. We have Erin Bain, who will be helping us with grants management on the team. And then Lisa Edwards, as most of you know, is our superintendent at Verdant Health Commission, and we'll be kicking off our call. So we'll go from there, and we hope to spend about 30 minutes going over information. We'll go through it as quickly as we can and then allow room for Q&A. And then just also a note that we'll be hosting 2 additional calls in November, so later in November. So more details about that shortly. All right, Lisa.
Wonderful. Thank you so much, Leslie. And I'd like to extend my gratitude as well to everyone who joined us today for this meeting. We have a lot of information to cover, and we appreciate your participation. We're going to start with a brief overview of Verdant, our new strategy and priority areas, and then we'll move forward from there. So next slide. Leslie already did a great job of giving an overview. Many of our grants team is on this meeting right now and available to be of support to you. As many of you are aware, we have 5 elected commissioners who are elected to 6-year terms, and they oversee our grant making process. And for more information about our commissioners or our staff, you are welcome to visit verdanthealth.org and learn more about the work that we do. Brief reminder for all of us as far as the vision and mission of Verdant is to be a sustaining public resource. And we are focused on the health and well-being of all of the residents of Snohomish County, and specifically South Snohomish County, our service district. And our service district, as you'll see in just a moment, is very similar to that of the Emmons Public Schools. Our mission is to improve the health and well-being of our whole community. And this map is one that we like to show because we often get questions from applicants about service area. And these are the specific zip codes and areas that we support. And as I previously said, it is almost an identical overlay with Edmonds Public Schools. There's about 10 or 12 blocks that we are a little bit different over in the Bothell area, but overall you can see the 5 municipalities that we support, and that is Linwood, Montlake Terrace, part of Bothell, Edmonds, and Woodway. And now we have a brief video that just gives a recap of Verdant and the work that we've done. Are we showing that or not?
I think in the interest of time, we just want you to know that video is available on the website. It's a really fun video, but in the interest of time, we're going to keep going. We want to allow time for our Q&A.
Okay, great. And so, yeah, the video's there and you can enjoy it at your leisure. And we'll be showing it at other events as well coming up. So real quickly, for those of you who might be new or not familiar with our history, in 2010, we entered into an affiliation agreement with then Swedish hospital system to take over and manage what was then Stevens Hospital. And it became what we now know as Swedish Edmonds. That was previously this year rebranded as Providence Swedish Edmonds. So from 2000 to 2011 to 2019, we have been providing grants to the community to advance access to healthcare around our priorities. These grants were one-time and many were multi-year grants as well. We also had during this period a special call for proposals for building healthy communities funding and awarded numerous multi-million-dollar grants for local community projects. During that time, we also were at the beginning of the pandemic, and Verdant stepped up and made a commitment to add an additional $1 million in COVID grant funding to support nonprofits in the community who were helping residents with testing and vaccinations and other COVID-related emergency needs. From 2011 to about 2022, during that period, we awarded $70 million in grants out to the community. So some of you may not be aware that we are a public hospital district, which makes us different than a foundation. And as a result, we follow state guidelines for the funding that we provide. In 23, we will be moving towards a new funding process and going from 4 quarterly grant cycles to 2 application periods. We will be discontinuing the COVID-19 emergency grant funding. And next slide. Here's a great overview slide that helps answer some questions that people often have. So as a public hospital district, about 85% of our revenue comes from leases of properties. And that is our lease of the hospital and then also our lease of units at the Kruger Medical Clinic. We also have about 10% of our funding, 10 to 12% of our funding comes from a levy tax that we receive. And then the remaining balance is income from our investments. We have 5 elected officials known as commissioners, and we follow state laws as a public municipal entity. We do have stringent oversight because we're a public hospital district who is dedicated to pushing funds out to the community. So it's a little different than a foundation. We have a lot more rules to follow and a lot more details to take care of. So we go through an independent financial audit that we pay for. The state comes in and they audit that audit. And then the state comes in and they audit us again. So that's 3 audits a year that we go through to make sure that we are fully compliant and being good stewards of the funds that we have. Our grant-making decision-making is a process where there's screening and scoring that occurs with recommendations from the grants team. And then it goes to the commissioners who make the final decision to award grant awards to the community. And so I'm not going to take a lot of time here to go over the rest of the slide. You can see on the right the difference between a public hospital district and a foundation. Next slide, please. And now I'm going to I'm turning it over to Leslie to go over our strategies and timeline. Thank you, Leslie.
Excellent, great. Well, we'll begin here by, I'll pick up from where Lisa left off, that in 2022, there was a community needs health assessment, which led to the identification of 3 priority areas, strategic priority areas. And so ultimately the goal is to advance this purpose of Verdant's funding opportunity, which is to support projects in South Snohomish County that align with the mission, and for those projects identified by the commissioners as the 3 priority areas. And those areas, as most of you may be well aware, are in mental health, healthcare access, and food security. And the goal is that each of those areas will help to improve the health and well-being of our entire community. And we have greater detail about these areas in on our website, you'll find both a PDF version and a page book where you can flip through and see more detail about each of these strategic areas. So I won't spend too much time on this. It's a lot of text to read, but essentially this gives you some ideas of the objectives and some of our strategies over the next 1.5 to 2 years and what we hope to accomplish. So when you're thinking about your application, your proposal, and the program that you're seeking funding for, consider whether you're in mental health, whether you've identified mental health, healthcare access, or food security as one of your priorities. Be thinking about these objectives. Really encourage you to take a look and familiarize yourself with these objectives, as well as the suggested strategies that we have here. And so again, I don't see a need to read that out. I'd like to save time for us to have to hear the questions that you have. But I really encourage you to look at the website and to either download or share with others who will be working on the application. Make sure that they are familiar with these strategic priorities. The substantive changes that we're looking at for 2023 and 2024 that you'll notice, of course, as Lisa mentioned, we're moving to 2 grant application cycles per year. So in 2023, we'll start with November 1st. It's opening up the grant application process, and the next one will be on May 1st for those contracts that are beginning October 1st. So for those that are applying in this cycle now, you will begin your contract will actually begin on April 1st and go till March 31st of 2023. And there's, as we mentioned before, there's no guarantee of renewal or continual funding. So there's no longer multi-year contracts. We're looking at annual grants as an opportunity for us to be more nimble and adaptive, as we saw that was needed in the past couple of years. And so this will give us a chance to test out these strategies. And after we are discontinuing COVID-19 funding, as Lisa mentioned, into the online application, we'll ask you to select a primary and a secondary priority area funding, which is optional. The secondary, do not feel any pressure to say that you are looking at your program is addressing both mental health and healthcare access. There won't be any additional scoring points if you select a secondary, but we know that often that your services are overlapping in some of our strategic priorities. So we'll ask that you select a primary with an optional secondary. And then for those organizations with a budget with funding over $2 million, we'll be asking you to also provide a statement, an explanation of your financial need. And it may be whether you have restricted grants or you'll have other reasons. All of that is detailed in our funding guidelines that you'll see on our website. We're also asking for co-funding sources so we can better understand the other partners that you're working with. And then you'll find a confirmation page acknowledging that you've read the guidelines, that you're eligible, and so acknowledging a number of your understanding of some of the funding parameters. So from there, those are the main changes that you'll see in this grant application. I won't go through all these in detail, but again, it's just to remind you that the funding guidelines will highlight for you the eligibility criteria, making sure that it's serving residents in the Verdant service area. We don't, as you know, with many other funders, we're not awarding for individuals or political or religious uses. I think a big question that comes up is there a minimum or maximum request amount? And at this time, we are not putting any parameters around that. We can only say that last year's award was approximately 100. The average was 100,000. We do expect this to be a very competitive cycle. And so to keep that in mind, but last year, that was last year's average. And we'll go from there. This is our timeline. We'll officially open up the application will officially open up on November 4th. We're testing it out now, and so some of you may be able to access it. Most of you probably should be able to access. We have everything already in the system as of today, so you'll be able to get to that. And then the deadline is December 2nd, and I won't go through this in detail, but to say that the board review will be happening in January. after the staff has completed its review, and then we'll be looking at making decisions. We'll be making decisions at the end of January. A sensitive keyboard here. We will have additional Q&A sessions to the community, so we'll talk more about that towards the end on November 8th and 15th. And then after decisions are made at the end of January, applicants who were declined can also look at the May 1st window when that will be opening up again another cycle. And at this point, I will turn it over to my colleague Maggie, who will talk about more, we'll go a little bit more into the details around the application process and other specifics around the timeline. To you, Maggie.
Thank you, Leslie. So just at a high level, kind of want to go through and make sure everyone's aware of the process. So like Leslie mentioned, we do have funding guidelines. We've updated our webpage today to reflect these changes. So we will be sharing some links at the end of this call so you can access some of that information directly. But we do encourage everyone just to go and review those updated guidelines. And then, many of you are here today, and just to remind everyone, we really do welcome questions. Please do let us know if there's any questions or issues with kind of the online portal itself. So many of you are already familiar. Many of you are already using our grants management software, which is called Flux. If you are not active in Flux, I strongly encourage you to set up an account as soon as possible. It takes about 3 business days on average for us to approve those registrations. So I highly recommend kind of getting that done now instead of closer to the actual deadline. And we have information as well on our YouTube page about how to create an online profile. And so, yeah, please let us know if you have any issues with that, but we do encourage you to register. And if you already are registered, you can log in and you'll be able to see the annual program application now. So after completing the application in Flux, you will have to submit your application. Make sure you submit by 5 p.m. on December 2nd, which is when the applications will be closed. And if you've not hit submit, we can't hit submit for you. So please do make sure you actually have hit that submit button so that we can review your application. So just as a kind of note, the blocks in green are kind of the responsibility of the applicant, and these other boxes are kind of internal to Verdant. So we go through an internal review process, which we will share a little bit more about later. And then just to note, many of you are returning applicants, but if you are a new applicant, as of right now, we typically have a short meeting with 2 of our board members, really just informal, a meet and greet for them to get to know you. And that is only for new applicants. And just to note that all of our funding decisions are made in our public meetings. So you are always welcome to attend those meetings, and final decisions will be made in those public board meetings, and we will notify applicants of that decision after that meeting. If your application is approved, we'll be in contact with you to initiate the contracting process. And if your application is declined, we will also notify you. And we welcome arranging a time if interested to discuss next steps if your application is declined. Next slide. Great, so just a reminder, all applications are submitted through our grant portal, which is using a software called Flux. We cannot accept applications outside of the portal, so please do make sure that you are registered. The official application period is from November 4th at 9 a.m. through December 2nd at 5 p.m. And again, make sure you have hit submit by 5 p.m. And again, just to emphasize that these are for contracts that will begin April 1st, 2023 and be good for 1 year. And again, you will be contacted regarding the outcome of your application after a January special board meeting. So this is a video we're not going to show, but just a note, on our Verdant Health Commission YouTube page, there are a number of tutorials about how to use our grant portal. There are also some informational kind of documents that take you through key steps in that application process that are on our website. Just to note, the YouTube video, those videos are from when the portal was first released. We've made some changes. So there's little details that have changed, but overall the process is the same. So those are still relevant. So just, just a quick overview of the application itself. There are 6 sections to the application. So organizational information, most of that is pulled over from your profile from when you create an account. Some details on the program itself. Just a note, if you have submitted an application to Verdant before, the program narrative questions are largely the same as previous applications, with a few small questions related to just gathering some demographic information. However, there are a few additional questions related to finance. So just for your own planning purposes, as Leslie mentioned when she was going through the changes, there are a few additional questions related to finance on your application. So just to be informed, so you can coordinate with whoever is needed in your department. We have the budget section, which is where you fill in your budget, which we'll go over in a little bit. Outcomes, as Leslie mentioned, there's some confirmations, and there's also some required documents to upload. So we'll go over a little bit of that later. And then just a note, you can, again, learn more about this on our website, which is up to date as of today. All right, so we have this little, I'm just going to call attention to it now. We have this little point of saving often. So just to note that in the grants management software, it does not save automatically, so you have to be saving. And we encourage doing this frequently, especially if something isn't working. It often just means that you need to save and kind of reset. So really do make sure that you're saving often as you complete the application. And just a note, we've added into the application some open comments field, and we really encourage you to make use of those note sections because we recognize that there's certain questions that different people interpret them different ways. There might be something unique to your organization. And so we really encourage you to use those open comment fields just to provide clarity or context when needed. And you'll see those a couple places throughout the application. I will just note here as well that we did add character limits to the application. So you will have limits in terms of the text that you can provide under each question. And that shows up as you're completing the application, and it counts down as you put text into those fields. Next slide. So this is a little bit of a change if you've applied previously. Previously, we allowed you to kind of fill in as many outcomes as you wanted. We are really encouraging that you identify up to 3 outcomes for only your primary strategic priority selected. So for example, if your primary strategic priority was mental health, we encourage you to identify up to 3 outcomes related to mental health. And then just to note as well, we require that all partners track the number of individuals served. And that is not something that automatically populates in our grants management software. So you will have to input that yourself. And then there will be a check mark that says, I have added number of individuals served as an outcome metric. So just to note, that is something you have to do manually. It is required. And then you are you can then identify for your own organization those additional outcomes. So again, just a note, there has been a slight change on the budget as well. So on the budget, we ask you to break down your expenses into 3 primary categories with the option to have expenses listed in a 4th category, which is just other. So we have personnel costs, direct program costs, and indirect costs, which I will go into detail about that in upcoming slides. which actually right now. Okay, so budget guidelines. Okay, so like I said, there's 3 primary categories for your budget. So the first is personnel costs. So this includes salary and benefits of organization staff that are supporting the program. And we really do, again, encourage you to utilize the notes section to just indicate FTE, roles, and other information to just contextualize those costs for the reviewer. We have direct costs. So again, we define direct costs as expenses that are allocated to a specific program. These can be training costs, materials, and one way of thinking about direct costs is just these are expenses for your organization that would not exist if not for the existence of that specific funded program. And so really these are, the costs necessary to do this particular program. In contrast, which I think we can go to the next slide, we have the indirect costs. So these are expenses that are not specifically allocated to the funded scope of work or function of the funded program. So these can be expenses that are shared, like often administration costs, that those costs go to support multiple programs, multiple locations. This can include certain staff positions. This can include office rent and utilities for certain things. So again, your administrative expenses. So just to kind of think of those indirect costs in this way, and we're always happy to answer questions related to that. And again, just a reminder that Verdant funds indirect costs up to 10% of the request. So we cannot fund beyond 10% for indirect costs. And then just a note for minor capital costs, those are allowed up to $5,000 in aggregate with useful life of more than 1 year. And right now, Verdant does not fund major capital costs. In addition to the application content that you will input directly into that application form in Flux, we do have some both required and optional attachments. So when you set up your organizational profile before actually submitting an application, you are required to submit the list of your organization's board of directors. So that is one of the required attachments. We need current financial statements and a list of funding sources, both secured and anticipated. We have letters of support. So this is a requirement only if you indicate that there are key partners involved in the implementation of this specific project. We kind of define this as a partner that without them, you couldn't actually implement the project. And if you do indicate that you have one of those partners, we need a letter of support. For example, if you said that Verdant Health Commission was one of your key partners, this is just a pretend example. So if you said, yeah, we're going to use Verdant facilities, we're going to partner with them to provide this service, you would need a letter of support from Verdant saying that, yes, we have talked and we've agreed and we want to support this project. There's other optional attachments. They are not required, but you can submit other documents, including things like your annual report. So just know that that is an option as well. Next slide. Okay, so for the financial due diligence piece, this is just to just make sure that you're aware of some of the requirements. And again, we will share our funding guidelines with you through the chat in Zoom at the end of this call, which kind of goes into a little bit more detail. But just to note that if your organization has an annual operating expense greater than $3 million, you are required to provide a financial audit performed by an independent accounting firm. If you have less than $3 million in operating expenses annually, you have to either provide a cost report or an internally prepared financial statement. So really just a note on the financial due diligence, I think, is mostly just to make you aware as you kind of prepare and enter into this November application cycle. Just again, kind of coordinating with who you might need to work with in your finance department. And we do review this information. So please just make a note of that. Next slide. And then I think I'm going to turn it over to Leslie.
Great. Yes. Thank you so much, Maggie. We'll take a breath for a moment. There's so much we've covered here, and we're just coming down to a few more slides, and then we want to open it up for question and answer. So do be thinking of your questions. Feel free to enter them in the chat. We'll also use the raising your hand or speak up, and we'll have a chance to cover those in just a few minutes. I want to cover at this section a little bit about our review process. So as Maggie talked through earlier about the workflow, we will have an internal process where the staff will be involved in reviewing the proposals and identifying how well the applicants are aligning with the scoring criteria, which is grouped in these 4 buckets. So each of the questions that are asked will be weighted and informing both staff and the commissioners about how well they are addressing the opportunity and community need for the program service, what kind of impact and how well it's engaging the community in the project, in the development of the project, or in its design, in its implementation. And so the diversity, equity, and inclusion will be an important piece of this, and how well is the community represented in that. And then that will be at the highest weight, that percentage there at 40%. We'll also be looking at desired incomes, and we recognize these are 1-year grants, and there's just only so much that folks can do in 1 year, but to the extent that you can have realistic, measurable grant outcomes in that time, we'll be looking at that, and that your budget supports that. And then looking at your implementation plan to carry out the program design that you have put forth, and how realistic is that, and does it have the right partners and coordination involved? So those are examples of some of the criteria that we'll be looking at in those buckets there. Great. Well, then I do want to add the review process that I want to mention, and it may have been mentioned before, that the staff is helping to provide information to the commissioners, but ultimately will not have decision-making authority on the grant selection. That will be up to the board to be, they'll be reviewing all the applications and discussing them, and collectively, it will be a competitive process, but collectively they'll be coming to terms of what proposals are best aligned to meet Verdant's mission. And then on this, we want to share with you that we have some application tutorials, as Maggie mentioned, that will really help walk you through each of the steps. We hope that you'll find the Flex system fairly intuitive and self-explanatory, but feel free to take a look at those video guides just so that you're familiar with what's coming next in that. As Maggie said, save often. We also will providing additional sessions just like this one, November 8th and the 15th on Tuesdays. We'll have that technical assistance Tuesdays, if you will, from 12 to 1. And then any questions that come from that we feel will be relevant to the larger community, we will provide in a frequently asked questions list on the website on that following Friday. So on Tuesday, November 8th, next Tuesday, we'll have another call, and then that following Friday, you'll see those questions posted too, so that you can always stay abreast if new questions come up. And as you're working on the application, it might jar for you some questions that have already been addressed. So we hope that will be helpful. Okay. Share with you questions that we often get. I'll go through these briefly, and then we can open it up for questions, but this might help. Do the programs or projects need to serve a specific population? I think we've said a few times, yes, they do indeed. I have a map behind me here too to show that it does need to serve the residents of the Verdant service area. You'll find all that information in the funding guidelines on the website. And if you don't have nonprofit status, which is the case for some organizations where they're awaiting their status or they're just starting up, what can you do? You'll want to seek out a fiscal sponsor. So that would be another organization that does have a 501c3 status, and they'll be able to serve as that legal entity for you. And they'll be sponsoring your project, and they would be the ones to submit the proposal. And they would speak then on your behalf about your proposed request. And then if my project or program is currently supported by Verdant and set to expire, can I renew using this process? And as you've heard from our earlier comments too, is that unfortunately, no, you will need to submit a new application for each annual award. And this will help to put everyone on the same level playing field. So we really want to look at an equitable process where everyone starts, from scratch out the gate. So there will be no renewals in 2023. And our last set of questions here before we open it up is, can I submit multiple applications? So some of you on the call may currently have one or two projects or programs that are receiving funds from Verdant and they're separate contracts. And so we would encourage you, if the timing works out, to strongly consider submitting one unified application in that it can be easier for tracking for other purposes. So if you have any questions about that too, you can feel free to reach out to either of us here at Verdant, and we can help you with that. What has changed this application process to reflect diversity, equity, inclusion? Well, you'll notice that the application, in addition to requesting a description of how you're involving the community that you're serving in your proposal, we'll also be asking for the data on community that you're working with that's benefiting from your program, as well as how that diversity is represented both on staff and as part of your board and your senior leadership. And so we'll be looking at this information to inform us on how well it's addressing this component of scoring. And will my proposal have a greater chance of being funded if I select more than one priority area? Excuse that spelling typo there. No, we're really, as I mentioned earlier, we're not going to be giving any preferential treatment. If you select 2 or 3 priority areas, we're asking you to select up to 2. But in all fairness, we recognize that some applicants are very focused in one of the priority areas, and so we want to be able to give some equal weight to that. And I think that wraps up the questions that we've been seeing come through. This is just a reminder that the application deadline is December 2nd at 5 p.m. And you can always reach us at grants@verdanthealth.org. And now we'll open it up to questions. So I think I'll stop sharing here. I'll give it a moment if anybody wants to take the QR code here. You can take a photo of that so you can access our website. And let's begin. We've got Aaron who can help us moderate the questions as well. Raise of hands. Anything sound confusing? Do you need clarification in any area?
I have a question. This is with the Washington West African Center.
Mm-hmm.
Do I wait for Aaron or do I just go?
Oh, go ahead, please. Thank you. Do you have a question?
We're not hearing you. Are you, can you share your question?
I'm not getting any sound. Anybody? No. Okay.
Well, while we wait for that question, why don't we move on
Okay.
to one
Yes,
in the
can you
chat
hear
that
me?
Natalie asked? Oh, here we
Yes.
go.
Yes,
Yes.
I'm sorry about that. Yeah, the thing kicked me out, technology, of course. Yeah, I said I'm kind of a little bit confused as to when, at what point or stage some of these decisions were made. For example, we were a multi-year grant receiver. And I remember when it was due for renewal, I engaged with Zoe back and forth multiple times as to what step we needed to take, whether we just need to renew and ask for the same amount because it's a multi-year, or we fill out a new application. And I think at some point she told me she had engaged with Miss Edward. I said, if we fill out a new application, does it affect actually she got word that if in case we happen to be declined or our application is not approved, we will just roll back to the same amount that we were previously on. Now hearing this information, one thing coming to my mind, some of us that have, let's say, hired staff, made commitment based on that multi-year grant we were expecting to receive. If there is no guarantee till the end of our
Oh, it's coming in and out, I think, isn't it?
Are you guys hearing me? Is it still cutting in and out?
It was coming in and out. Would you be able
Yeah,
to
so
type your question or go
yeah,
ahead if you have it?
yeah, I am just saying for people like us who have signed, let's say, a contract or hired staff based on this grant that we have with Verdant. Now, if there is no, and we were working hard to meet our deliverables, how are we going to navigate that, or what is going to happen in terms of engaging our board and stuff like that? It's really something that I'm trying to wrap around. The second thing that I want to ask is about, and this is a feedback too, since the Verdant team is here, is around deliverables. Communities like us, we are working hard in terms of collecting data. These are things that we've reflected in our applications throughout and our engagement in the feedback sessions we have with Verdant. It is very difficult for our communities to provide us with data. We are getting 30 to 50% of, we are able to collect 30 to 50% of the number of people we are serving. How proportionately will it be, or how fair would it be for institutions like ours or communities like ours that are having a real hard time because of all the different things that have been said around immigration and other things, other concerns that the community have? We are not able to provide Verdant with the actual numbers that we are serving. How are we represented here if we are declined because we are not able to provide the outcomes based on the fact that it's not that we are not serving the people, but people are just not giving us data, and Verdant is relying on that data to make those decisions. I don't know how, whether I'm making sense or not, but we are having a real hard time collecting data, and we are only able to provide 30 to 50% of data versus the number of people we are serving. These are the two questions I want to ask. One about the multi-year grant and the decision and when it was made in terms of how we are going to coordinate that with our board and what we are going to, and the second part has to do with the data. Thank you.
Maggie, do you want to take the first one and I'll take the second part on data?
Sure. So I do think this has been a question that's been raised by a number of people, and particularly I think this has been discussed in some of our community forums, but unfortunately, I know specifically for your contract, the decision was made after that you had already applied. So this is now a decision that was made in August. And we have been communicating that out. This was a decision made by our board. So what it does mean is that there is no more multi-year funding, that contracts will go through the end of their current term. And then you will have to reapply on an annual basis. We do have 2 more community forums coming up. If you want to raise some of these questions specifically to our board who made these decisions, we can maybe drop those dates in the chat, but we have a community forum in November and another one in December. which is an opportunity for community members to ask some of these questions about funding priorities, about the strategic plan, and some of these decisions that have been made about funding cycles, including these questions of moving from multi-year agreements to annual contracts, and changes to current partners who were expecting multi-year commitments, and now are having to do the full reapplication on an annual basis. So what that means practically is that anybody whose contracts are kind of expiring in the next, particularly the next 6 months, you do have to reapply. Unless you reapply with a full new application, there is no guaranteed funding beyond the end of your current contract date. And those contracts are always issued annually. So that will mean that even if you did previously apply, you will have to reapply for a new annual contract. So I do recognize that this is a big shift for a number of partners. And so we do welcome also participation in those community forums to bring some of this feedback directly to our board. I don't know if Lisa or Leslie have anything to add.
Thank you, Maggie. I think that was very well put. So we are all working to navigate and implement these new policies and to provide clarity as much as possible to our funded partners. And so the 6-month contract pod that I think you're referencing for your board, unfortunately, because these decisions were made during a grant process, we did offer a shortened contract to get to the new funding cycles. So that was our effort to continue to give the grant awards and transition organizations to the new funding processes.
And to answer the data question, we are only asking estimates for any of the quantitative data that is in the application. You'll see that it's estimating percentages, and please add additional context in the notes field. In terms of the scoring from the commissioners and the internal review, none of it is based on just the quantitative data. We're going to be looking at the entirety of the application to make scores. So please just do your best estimate for the quantitative sections, and then provide any context in the notes section, as well as the other questions that are asked throughout the application. Leslie, could you take the first question in the chat, and then we'll ask Arun to unmute and ask their question after we answer Natalie's question. Thank you.
Oh, great. Sure. Natalie's question is, what are the reporting requirements for the grant? Is that right? What will happen with the info data generated from any grant project if required to report? So the reporting requirements will be, it's a great question. We've included that information too. You'll find that in our grant management guidelines. That'll be on the website. It's on the website as well. But to answer that briefly, we're looking at 2 reports. So one will be at the 6-month mark, and one will be following at the end of the contract end date. And we'll be asking for the data over the year. And we will be, we want to be as sensitive as we can as to the data burden that this could, that we can try and reduce that as much as possible. And so we'll just be asking for data that is relevant to the outcomes that you have indicated. And that's in part why we've asked for, we've limited it to 3 outcomes. So you're not having to track, which can happen often if you put too many outcomes and you're being asked to track and report on those. And so we will be asking for that, as well as your budget to actual, your actual to budget expenses. So if you've said X dollars for personnel, it would be in those 3 categories: direct costs and indirect costs. We would be asking for your actual expenditures against the budget. And then, you know, lastly is really just hearing success stories from you. And so that anecdotal information, as well as the taking the data collectively, will help to inform. We want to look at each of the areas, the strategic priorities, and look at those to see what kind of traction that we're able to make in our communities. And so our aim is that we will have some community of practice and learning around mental health, around food security, so, and also for healthcare access. And so that those organizations that have selected those as their priority areas could come together and learn from one another. It could be, call, but we can create some groups that will then inform if we've got the right approach or what we're missing. So, okay. Anyone want to add to that? Is that okay on our team? All right. So next question.
Yeah.
Yes.
Sorry. This
Please
is
go
before I ask my question, I just want to add a little piece to the discussions we already had, and just a comment. We don't want to discuss it further. Talking about what Pa was talking about, it really impacts smaller organizations because they need to plan ahead. And when these fundings are major portion of their operating expenses. So if it's just an add-on or complement to their existing budgets, then they can work around and plan for the future. But if this is the main funding for a particular action, and if you want to hire somebody and you don't have any longer term plan, then we become very hesitant to actually do a good job, or we're not efficient in that. So that's one comment I would like to make. Second comment before I ask question, I heard something about actuals, and that kinds of, I'm not sure, you're talking about the receipts for every purchase we make or actuals, because actuals becomes in a corporate world very laborious work for smaller organizations. So I'm not sure we can like to hear about that. So the question I have is about the scoring, and if you can flash it back on the screen, or the third one was their outcomes. And I think I understood the other three, but I'm not sure what are the outcomes that you're looking for in that criteria.
Okay, 1 second. The desired outcomes, is that right?
Yes.
Yes. Okay, we had about 15% criteria on that. 15% weighted on the score. Let me come back to our.
I can drop in the question from the application. That will be used in the scoring for that section, if that's helpful, Leslie.
Okay, sure.
And if it is explained in that question, I'm fine, because right now, going through to right now, I was not sure how would I answer that question. But go ahead, please.
So go ahead.
Sorry, I was going to say, we encourage everyone to just read through the application and let us know if you have any questions. The scoring was just to let you know like how we'll be scoring it later on, but every single question in the application will map to that grid that you saw. And so all of it is relevant, and there will be, multiple questions throughout the application that will map to each of those different buckets.
Okay, thank you.
Okay. Next question. We did have a question whether we can still apply for COVID grant. What is the final cutoff date? And I want to check in. We can get back to you on that. I think that question came from Susie Chandler. But it does go through the end of December, any spending on that. So you'd want to get that in soon if you have a COVID-related request. And trying to track Sherman raised their hand. Go ahead, Sherman. Oh, sorry.
Hi, thanks, guys. Sherman Gong, I'm with the City of Bothell, Transportation Planner here. And we became aware of Verdant and everything from a council member here that was aware of the work you guys do and everything, and had us look into it for our bicycle plan, because we are completing that and getting that adopted soon, maybe December or January through council and everything. So my question is, I know our portion in Bothell that is in the district, Verdant district, which I'm trying to actually find on the map on your website, but I can't locate that. Is pretty small, so we don't have a lot of area that we can apply that I would think that, but there is a school, Frank Love Elementary, that I think would be appropriate that we could look at potentially projects from an education standpoint for safety and bike riding and everything like that, that would apply in that area. So I'm just kind of curious, since I've not been through this application process before, how that would work in, since we don't have the project defined and everything has to be well, adopted by the council first for the plan, and there's different things that are going to happen, but I know the deadlines are coming up. So I don't know if that makes sense. I'm just trying to get a handle on timing mostly, I guess.
Sure, understood. Thank you for your question. That does sound like that will be a timing challenge, but I think it would be best if we can talk offline and see what you could put forth, how much of it that you do have shaped that would require, the level of decisions that need to happen or approval that need to happen. See what you could put forth. So it might be best if we could have a conversation on that.
Who do I talk?
You can reach out to me.
Okay, Les.
And so, yeah.
All right.
Leslie.silverman@verdanthealth.org. So
okay, that's great.
Reach out to me. Okay.
Okay, thank you.
All right. We can talk more about those specifics, but it's a good question. Yes. Yeah. We've got another hand up from trying to see, looking across here.
Rahel, do you want to go next?
Yeah, Rahel
yes,
has her hand up.
Okay, great.
I wrote it on the chat, but it's a quick question. We were the recipient for creating chronic disease prevention and health and wellness programs for the East African community. And we currently are funded through the end of December, but the classes that one will start next week, and then that will go until it's a diabetes prevention and weight loss classes, and then we have an exercise classes. So my only question is, and also we help with resource navigation, including connecting people to health insurance or other resources. Do we have for this funding, do we apply for renewal, or do we need to submit a new application for next year?
Great. I'm going to let Maggie,
Yes.
timing wise, just to see if you may have more history on this one. So
just a note, Rahel, I think you hopefully got an email from us, and if not, let's follow up afterwards regarding, so we do recognize that there are a group of current partners that their funding expires on December 31st, 2022. And so we have actually issued 3-month cost extensions. So you'll be receiving 3 additional months of funding to get everybody who's expiring in that kind of in-between period to the next application deadline. So that is only for partners who have contracts ending 12/31/2022. But it does mean, so you will have to reapply in this November cycle, though, to have any funding beyond March 31st, 2023. So, and it has to be a full application. It's no longer a renewal. So do make sure that for funding beyond March 31st, that you've submitted an application by this current cycle deadline, so that can be reviewed. Because so just, I think on your particular one, it's just important to note that it's a full new application for a new annual contract. It's not a renewal, and that you will have a 3-month continuation funding to get you to that new potential start date. Again, no funding is guaranteed, but those decisions will be made in the January board meeting so that partners have 2 months notice of either continuation or no additional funding. So that's kind of the purpose of that timeline, and also that purpose of that continuation funding, so that critical programs can continue and have sufficient lead time ahead of any discontinuation of further funding.
Thank you for that information. But just quickly, if no matter what, we still would like to continue what we started. If by any, for some reason, if we're not approved for a grant, would we still continue to work with the community that we start working at? Because all of the programs we're doing currently at the Verdant, Health Center, does it have any effect, or are they connected, or how does it work? This was our first year, it's just the first year. So I don't if we get declined and not approved for a grant, do we need to stop offering program? That's not what I want to do, but I don't know how that works.
Yeah, so and I think Lisa, you can jump in, but your use of the Verdant Wellness Center is not dependent on having funding. So you can continue, I believe, to work with Casey and Monica and our team here that kind of manages the Wellness Center for using the space. This is a space that's meant for the community. Lisa, so that wouldn't be dependent on having funding from us. We have partners that use this space who don't receive any funding from Verdant. So Lisa, I don't know if you want to add anything there.
Absolutely correct. The Verdant Community Wellness Center is for the community, and our meeting rooms, our classrooms, and our teaching kitchen are available for free for our community partners, with or without any other kind of funding.
Okay, thank you.
I think we've come to our 11 o'clock or a few minutes after, and we appreciate so much everybody's patience too, as we work through a lot of material, a lot of content, talk through some changes, and there's still more questions that will be coming up for you. Again, please feel free to, Erin had included in the grants@verdanthealth.org, probably the best. That way we have a shared resource box that each of us can check that email folder at any time and be able to provide a timely response to you. And we encourage you again to look at our website on the very first, when you sign on, you'll see the community forum dates there. So if you have any questions or want to convey any of your comments or input, provide that. And you'll also find our funding guidelines there as well. And we'll have 2 more calls. And so when you start getting into the details, you may have further questions, and we encourage you to join those calls. So at this point, I will turn to my colleagues, see if there's any other comments or anything else to add. Maggie, Erin, Lisa, are we good?
Thank you all for joining and taking the time. And oh, sorry, Maggie, go.
Sorry. So just one clarification, I might have misspoken, but we did just want to clarify that for the independent audit, it's $3 million in gross revenue, not $3 million in expenses. So that independent audit requirement only applies to partners with $3 million in gross revenue. So just to clarify that point. But yeah, thank you all for coming. And Erin, I'll pass it over to you.
Can we have the slides, please? Is it possible to have the slides? One last question.
Absolutely. Yes. Be probably posting them on the we'll be sharing them out to the participants on the call. We'll be getting those to you in the next day. So
thank you.
They'll also be on our website.
And if you have any feedback for us of what we can do to improve this, since we'll have 2 more calls, let us know. We'd welcome your feedback anytime. That would be very helpful. So if this was helpful to you. So thank you. Enjoy the rest of your day, and we'll look forward to hearing from you if you have any questions.
Thank you.
Bye-bye.
Thank you.